exercise during pregnancy? Do you think it's safe?
Yes, I think I do.
No, surely not.
Yeah, I think it is, yeah.
I don't really know.
No.
Don't you worry, we're here to help. We're going to show you the advantages, the disadvantages, some recommendations, and the continued benefits that come with physical activity during pregnancy.
Once upon a time, there was a woman named Sally who was unsure whether or not to participate in physical activity throughout her pregnancy. Women like Sally are not educated enough on the advantages that come from physical activity during pregnancy. Look, Sally, I'm sure you'll be pleased to know that there are so many advantages to exercising during your pregnancy. Exercise helps a mum manage their stress levels. Pregnancy can be scary, especially for first-time mums like Sally. Imagine if you could relieve some of that stress and give your body a boost all at once. 9 months is a long, long time to be carrying a little human in your belly. 80% of women who exercise during their pregnancies give birth before their due date. Trust me, Sally, after carrying your baby for 9 months, you will seriously appreciate this one. Moderate exercise increases the placental function and growth. Exercise during pregnancy can control weight gain, which will help Sally be mentally stronger due to feeling confident in her own body. Unfortunately, gestational diabetes is one of the many risks for mothers post-birth. High blood sugar during pregnancy puts you at extremely high risk for developing type 2 diabetes in the decade after delivering and raises the odds of preterm delivery or having an overweight baby. Exercise can prevent your need for insulin and other medications, which is obviously a huge advantage to the mother. Sally, as your pregnancy progresses, sleeping might become more and more difficult because finding a comfortable sleeping position can be a challenge. But by exercising, you'll be tired, which will potentially lull you into a more restful sleep. Exercising while pregnant will change Sally's cardiovascular system. It will give greater flow of nutrients and oxygen to the baby, which benefits both the mother and the baby because of the 40% increase in maternal blood volume and a heart rate increase of 15 beats per minute. Look, Sally, I know you might still be frightened, but try and think of these advantages that come with exercising during your pregnancy.
Walking back from a birthing class, feeling assured that it would be advantageous to maintain a level of physical activity, her track was suddenly interrupted by a strange old woman. The woman warned her about the outcomes that could possibly occur if Sally was to be physically active during pregnancy. Although the woman seemed crazy, she was right. There is some discrepancy when it comes to the benefits of physical activity during pregnancy. The changes within a woman's body during her pregnancy make both mother and child more susceptible to injury and harm, as the physiological systems within a pregnant mother's body are so vulnerable to change. For example, pregnancy is associated with an increase in blood volume of about 40%, approximately a 20% increase in stroke volume, and an increased cardiac output. While these systems change to support the mother and child, they are also sensitive to the impacts a mother inflicts upon her body. These systems adapt because the developing fetus needs constant energy, such as oxygen and nutrients to support metabolism and growth. If exercise stress compromises these systems, it is thought that growth and development cannot progress normally. The effect of extreme strenuous exercise and exercise in the third trimester on functional growth is unclear, but some studies done with animals suggest a link between strenuous exercise and reduced birth weight. But these studies have not been replicated in humans, because mothers would have to be made to run extreme amounts till they reach a point of utter exhaustion. Thus, due to ethical reasons, these studies cannot take place. Physical activity is of course only one of the factors that could contribute to an outcome such as reduced birth weight. But what if these studies hold merit? When a woman isn't pregnant and exercises on a regular basis, she naturally loses weight over time. Why would it be different for pregnant mothers who are supporting the growth of a fetus within their bodies? Would it not be worse for a pregnant mother to lose weight? Physical activity is a behaviour that occurs in a variety of forms and contexts, including house chores, organised sport, and simply walking. It refers to any movement produced by the skeletal muscles, and that results in an increase over the resting energy expenditure. This is not to say that any slight movement like raising the arm or walking to the front door will cause a developing fetus to be born underweight. The systems in the human body are 1,000,000 times more functional than that, but extreme levels of exercise could result in a lack of fetal growth.
Just as Sally was about to give up on being physically active, Dr. Jess appeared and saved her from her mind's despair. Don't worry, Sally. You don't have to be concerned about these risks. Just follow these helpful recommendations I give you. Dr. Jess led Sally to her office, where they began to speak about appropriate recommendations for being physically active throughout pregnancy. As you have been previously active and experienced no major chronic or acute health issues, here are some guidelines for you to be aware of. You must maintain an appropriate heart rate throughout physical activity to aid the development of the baby's organs occurring throughout the first trimester. This could be as simple as a light walk. I recommend participating in physical activity 4 times a week for 30 minutes at a moderate to vigorous intensity during your initial stages of pregnancy. Both aerobic and resistance exercises such as swimming, aquanatal classes, walking, stationary cycling, and pregnancy yoga and Pilates are all safe and efficient forms. Whilst active, it is recommended that you complete a talk test to regulate controlled breathing. You must be able to competently talk without breathlessness to avoid overtraining, which can place harm upon the developing fetus. Also, you must be able to recognise the signs of when to cease physical activity to avoid harm to yourself and to the baby. Signs include bleeding and unexpected cramping. If contradictions occur, you must promise that you will come back and see me straight away. Sally, it is essential that you decrease your volume of physical activity as your pregnancy progresses. This means lighter intensity, duration, and forms of activity. Participation in lighter activities such as aqua aerobics or pregnancy-specific yoga are still beneficial to increase strength, maintain cardiovascular fitness, and promote physical comfortability as the developing baby grows. And don't forget, you must drink a lot of water and keep hydrated whilst engaging in any form of physical activity. Sally breathed a sigh of relief as she began to realise the safety and efficiency of physical activity whilst pregnant. She felt more aware of how to keep herself and her baby happy and healthy by continuing to be physically active in moderation during her pregnancy.
Thanks to Sally making the wise choice of being physically active while she was pregnant, both baby Justin and Sally will experience many benefits that will span over both their lives. Justin was born at a healthy weight and wasn't born too prematurely because of Sally's choices, and as a result, as Justin develops, he has a more efficient cardiovascular system which will last into his childhood years, as well as he now has a major reduction in the risk of being overweight at school age. Similarly, Sally has reduced her risk of gaining excess weight during pregnancy and contracting gestational diabetes. By doing so, she has also decreased her chance of developing diabetes later in life. Mothers like Sally also foster a supportive environment while Justin grows, which is just as crucial in deciding whether Justin grows up healthier, rather than just Sally exercising alone, as it results in lower levels of obesity, blood pressure, cholesterol, and high levels of bone density, therefore reducing the risk of factor for lifestyle diseases such as cardiovascular disease, type 2 diabetes, and some cancers. But it's not just Justin and Sally's physical health that has benefited, their mental health is better off now too. Exercise gives Sally a release and helps her cope with the demands of motherhood, reducing her chances of depression, while Justin recently scored an A+ on his math test. And since Sally has continued to exercise since giving birth, Justin is 5.8 times more likely to be active than his friend Tyler, whose parents are both inactive. Not only does Sally's choices help them both in the short term, but also in the long term. 20 years later, Sally only gained 3.2 kilos as opposed to the 10 kilos Tyler's mum gained, who also had higher cholesterol levels. Justin also got picked for the university soccer team while Tyler missed out, as a study suggests that because Justin was exposed to exercise while in the uterus, he performs better aerobically, and they lived happily ever after.